Oscar Sanchez loves to dance.
You just get this vibe from the crowd when you're out there doing your thing, especially when you hear like the oohs, the ahs, the screaming.
He followed in his parents' footsteps, both dancers, and it even earned him several invitations from Hollywood.
Some of the movies I danced in were Shall We Dance, Make It Happen, The Love Guru, Repo Men, and Tamra.
But several years ago, his time in the spotlight started to fade.
When I was with my dance group, we would have the routine and everything, perfect. And then when it came to performing, I wouldn't wear my glasses. So potentially, me going out there, I was dancing blind.
This is what a typical dancer would see. But Oscar's vision was blurred and distorted. And then came the diagnosis.
Keratoconus is a disorder of the cornea, which is the outer layer of the eye. In most normal people, the cornea is sort of smooth and round-shaped, focusing light. In keratoconus, the cornea is a dome-shaped protuberance, so it's not able to focus the light clearly on the back of the eye.
Left untreated, Oscar's vision would have deteriorated.
Oscar had very advanced keratoconus, in which his cornea, not only was it very steeply cone-shaped, it also had scarring that was not permitting light to go into the inside of the eye. This is a donor cornea.
But Dr. Stephen Brodowski, an ophthalmologist at the Buhler Eye Care Centre, performed an intricate cornea transplant.
The cornea itself is about 500 microns or half a millimeter in thickness, and the piece that I would sew into most patients' eyes would be in the order of 7 to 8 millimeters in diameter, and then it's sewn in with a very fine thread, usually 16 stitches, somewhat like a Singer sewing machine. It goes in a zigzag pattern.
Thanks to a donated cornea from the Misericordia Eye Bank, Oscar's prognosis is looking very bright.
I'm very grateful just being able to see detail with my particular eye. Also grateful in regards to knowing that there's an option for me to get back into dance.
Recognized nationally, the Buhler Eye Care Centre is the largest surgical and eye treatment clinic in Western Canada. This leading-edge facility performs over 10,000 eye surgeries a year and 25,000 eye assessments and treatments annually. Leo Shearer has also benefited from that excellence in care. As an active senior, he walks up to 10 miles a week. But this spry 86-year-old felt that his eyes were aging faster than he was.
My eyesight kind of deteriorated, and there was this spot.
Leo was diagnosed with wet age-related macular degeneration. It's an illness that slowly deteriorates the center of the retina, causing blood vessels to grow abnormally and eventually leads to blind spots.
Hi, Leo. How are you doing?
Good, thank you.
But Leo was lucky.
Okay, let's have a look at your retina. I'll just get you to take your glasses off.
He met Dr. Frank Stockel, an ophthalmologist whose focus is restoring sight to those affected by this growing problem.
Approximately 1 in 10 people in the general population would be affected by macular degeneration, and people over the age of 70 years of age have a 1 in 4 chance.
45% of patients treated at the Buhler Eye Care Centre suffer from macular degeneration. Dr. Stockel says there is hope in sight with surgery and proper treatment.
The treatment entails injecting a drug into the eye. These injections need to be repeated, usually monthly.
And after just 3 injections, Leo noticed a dramatic difference.
Now, I can see the same way I did before I got this thing.
Leaders in cataract, retinal surgery, and glaucoma, the centre also specializes in oculoplastics and is now focusing on one of Canada's other growing vision problems.
The peripheral vision was disappearing and it was cloudy.
This mother of 2 was born with diabetic retinopathy, triggered by her type 1 diabetes.
My eyesight before the surgery would be like taking a hot, steaming bath, stepping out, opening the door, and the mirror being foggy.
Diabetic retinopathy is the leading cause of blindness in working-age adults. It affects up to 500,000 Canadians, and that number is expected to rise as more people are diagnosed with diabetes.
Of all patients with diabetes, 40 to 50% will have retinopathy, which is a huge number.
Through laser surgery, Dr. Stockel was able to preserve Shelley's eyesight.
You don't realize how much you use your eyes for everything. It's a gift. It's a gift we take for granted.
Today, life is pretty much back to normal for Shelley. She enjoys cheering on her sons, McKenna and Quinn, who play hockey.
I just want to say thank you so much, Dr. Stockel. You're a gifted surgeon, and thank you for letting me watch my children grow up.
Leo credits every step he takes with the care he received at the Buhler Eye Care Centre.
Thank you. You've given me my independence back.
As for Oscar, he's reignited his passion for salsa dancing and couldn't be more grateful for his new outlook on the world.
Gracias, Dr. Brodowski, for bringing my group back.
And thanks to you, your generous donations make it possible to provide thousands of patients each year with the highest quality of care and the most advanced treatments available at the Buhler Eye Care Centre's world-class facility.